Nctv45 Newcastle, The Train.
The Gathering Banquet Center, an event center located at 2552 Ben Franklin Highway, is the right place for an event. Many buffet dinner packages to choose from, and it makes any event special and elegant. Call 724-652-1149 and let Gatherings serve you.
$15.53.
Seasons change, and when that summer wind blows in, Seasons Change is ready for you. Seasons change, and when the fall brings that autumn rain and down come the leaves, Seasons Change is ready for you. In the winter, when the wind blows and the snow, Seasons Change is ready for you. And then it's spring, and things will bloom, and Seasons Change is ready for you. It's Seasons Change, beautiful shop, right in the Majestic. 134 North Street and 139 Fall Street. Seasons change.
Get to Dad's Bar before the rooster crows. Yes, it's Tony's Lounge. Complete with a great bar, pool, yes, jukebox, and a great seating area that is unbelievable. It'll make you hungry, and a wide selection to choose from, including wings. Yes, specials too. Don't monkey around. Get to Tony's Lounge. Hello and welcome to Nctv45's Midday Newswatch. And the COVID situation is a serious situation. And I want you to understand that I don't doubt it for a second. However, it has become Pennsylvania's version of comedy at the Improv, as these folks come to us every afternoon with all just a bunch of stuff that they're not making any sense. First of all, your leadoff man in the comedy hour seems to be none other than Chris Sonata. And here's why. Every day, Chris Sonata takes the Department of Health report, breaks it down from the little map. We haven't even had to do that. All he has to do is watch Newswatch. And then regurgitates how many new cases are in Lawrence County. Chris, Please. It's getting old. 72 minus 7 is 65. On April 30th, we had 65 cases. We should be in the green phase, Chris. It's your Democratic governor that hasn't figured it out yet. Please allow him some time to sit and talk with you and explain how he's just really doesn't have a plan, and in our humble opinion, he's ruining the state. I mean, this is out of control unless somebody steps in. We did the back checking here. And I want you to understand this. We did the back checking from the 30th. We've been keeping track, Chris. Okay? You're in an election. It's the only way you think that you can talk to people. April 30th, 65. That was right on Newswatch. Holy cow. I mean, really? And you know, nobody doubts Chris is a good person. Now, up first, okay, we have, and this is, I want to make sure, let's go now, let's see if they've got it. Here we go.
At the food banks. We also coordinate in the early stages of the incident, support through the Army Corps of Engineers for assessment of alternate care sites across the state that were potentially needed to handle the medical surge associated with COVID-19. We looked at a number of sites and facilities across the state in case we would realize a significant impact to serve as these sites and what it would take to be able to establish them and be able to staff them. We still maintain a number of sites across the state in a warm status, just in case we would have an additional surge in the fall. We've also assisted in procuring additional materials and staffing through FEMA in support of the COVID-19 response. As the governor had indicated, the early acquiring of a Battelle system for the Commonwealth of Pennsylvania alleviated some of the needs on N95 face piece respirators for the medical care community. The last update we received, they have over 300 agreements signed for agencies across the state to be able to send their N95 masks to the Battelle system for decontamination to be able to be reused. We've also worked with the Federal Emergency Management Agency and Health and Human Services to be able to acquire medical personnel to be able to assist at the alternate care sites, most specifically the alternate care site in Philadelphia. But these medical personnel also assisted in a number of the impacted hospitals in Philadelphia and the greater Philadelphia healthcare system. And obviously, we coordinate on a regular basis with the National Guard to provide support to long-term care facilities, feeding missions, mortuary support services, especially in the Southeast, in some of the hardest hit areas during this crisis. The National Guard continues to be a great partner. They are there usually throughout any disaster with us, and we appreciate their support. These are just some of the examples of the support that's been coordinated through the agency. However, as I indicated previously, we can't do this alone. One of the critical components to the emergency management system in the Commonwealth, and as the governor alluded to, is our city, county, and municipal emergency managers. They play a crucial role in providing operational coordination and assistance across county and local governments in support of the state efforts. While it would be extremely rare for a natural disaster to affect all counties simultaneously in the Commonwealth, this disaster or crisis is much different. All counties have been affected to some degree and have been actively engaged throughout the response thus far. Their tireless efforts in coordinating support at the county level are critical to having a safe, well-planned, and well-executed response. This crisis will undoubtedly be one of the longest, if not the longest, and most complex response and recovery operations that our agency has ever undertaken. It will require everyone across all response disciplines, levels of government, and agencies and organizations working together to address the complex problems that have resulted and will continue to result from this crisis. PEMA and the extremely dedicated individuals managing this response across the state remain committed to assisting and supporting the citizens of the Commonwealth during this crisis. Now, I'd like to turn it over to Colonel Montgomery from the National Guard, who, again, as I said, has been a great partner during this response, to speak in greater detail about some of the support they have provided during this crisis. Colonel Montgomery.
Thank you, Director Padfield. Again, I'm Colonel Frank Montgomery. I'm the Director of Military Support for the Commonwealth. I'd like to thank Governor Wolf and his administration for the opportunity to speak to you today regarding the Pennsylvania National Guard's response efforts in support of the Commonwealth for COVID-19. I'd like to thank Director Padfield, Deputy Director Sevenson at PEMA, Secretary Levine, and at the Department of Health and their respective staffs who've enabled the National Guard to rapidly respond to need and integrate with our agency partners in support of local governments across the Commonwealth. On behalf of the Adjutant General, the Pennsylvania National Guard, Major General Anthony Pirelli, the National Guard has 1,200 service members dedicated to supporting Commonwealth agencies in response to COVID-19. These soldiers and airmen come across the four corners of the state and have selflessly served for the past few months. Our forces are broken into three geographical task forces, North, South, and West, as well as functional task forces to include logistical support, force health protection, aviation, and medical operations. A summary of our missions that Director Padfield covered briefly state how the National Guard was involved. Started off with the repatriation of 21 passengers from the Grand Princess cruise ship, where we transported them from the Harrisburg airport to their homes. As the director mentioned, we established 2 community-based testing sites, and to date, we've tested over 12,000 citizens. We supported the Greater Pittsburgh Community Food Bank, packaging over 90,000 meals for families in need. We've transported various commodities across the Commonwealth to include PPE, medical equipment, and over 550,000 meal kits to numerous organizations. We assisted with setting up 2 alternate care sites. We also established a dual status commander led by Brigadier General Mark McCormick, who oversaw medical operations for both Pennsylvania Guardsmen as well as Title X Reserve Component forces assigned from Northern Command. Approximately 85 medical professionals who conducted missions in 7 Philadelphia area hospitals, as well as the alternate care site at Temple University. In collaboration with PEMA, the Department of Health, and the Hospital Association of Pennsylvania, we established a medical planning team that coordinated efforts with respect to long-term care facility support. They have developed an assessment protocol and visited 13 sites who requested assistance with staffing and training. Teams were built to include physicians, nurses, medics, and general purpose forces to provide staffing assistance, as well as any training in the use of PPE, don-doff procedures, or decontamination measures as needed. It's an honor for us to work alongside with long-term care staff to serve this vulnerable population. To date, we have provided over 3,500 days of staffing support to 10 long-term care facilities, and we are still currently supporting 5 such facilities. We are standing up a mobile testing capability where the National Guard will send teams into long-term care facilities identified by the Department of Health to assist with conducting tests for residents and staff. We provided assistance to the Philadelphia Medical Examiner's Office with the dignified transportation of decedents from area hospitals. We currently are and will continue to conduct screening operations for our own personnel, ensuring our own force health protection. We've conducted 31,000 such screenings to date at many of our facilities as we transition back to our federal mission requirements. Our leadership, the Joint Operations Center, and the task force staffs have been working diligently to ensure the timely success of these operations, the safety and well-being of our service members. We've been coordinating with National Guard Bureau and many other states on their response efforts to ensure that we are implementing best practices. So, the bottom line is we live here, we train here, we serve here. We're proud to take care of our fellow citizens who are in need. And at this time, we'll take any questions.
Our first questions are for Governor Wolf. We have several questions from 6ABC about gyms. What are the penalties for gyms that reopen?
Well, when we talk about penalty, the real penalty is that the people risk getting sick. And I'm not sure how gyms are regulated at all, but if they depend on a license from the Department of State or Department of Community and Economic Development or the Department of Health, then that's where the responsibility lies. But the primary responsibility here lies with the business and the person making the decision there and the customer. And every time a customer goes to a gym, right, with this coronavirus, as contagious as it is, they risk getting sick.
Gym owners we spoke to say that they can follow fewer people in their gym and have health precautions in place, and it would be safer than the crowded workouts people are having outside right now. What is your response to that?
Yeah, again, we're looking at a situation where every time when you bring people together, when they touch things that others who have the disease have touched, they increase the risk that they're going to get the disease. We're trying to keep people safe, and every time people get together for whatever reason, they risk getting sick, and we want to keep that from happening.
And finally, from 6ABC, at the very least, to survive, gym owners say they need a timeline as to when they can reopen. Can the state provide that?
No. Again, we have a timeline that's being set not by the state, it's being set by the coronavirus. And we're looking at ways to defeat that virus. And that's what we're trying to do, taking advice from people who have done things like this before, from public health officials, from the federal government, from local governments, from the state. And all of this is in service of trying to keep people from getting sick.
Our next question is from ABC 27 for you, Governor. NASCAR is scheduled to race at Pocono at the end of June. On Friday, you said Pennsylvania is not ready to make a decision about that race. What criteria are you waiting for to make that decision? Would you allow NASCAR to race without fans if Monroe County is in the yellow phase?
Yeah, if Monroe County goes to yellow before that race happens, and NASCAR, in fact, has the competition without spectators in the stands, and they follow other guidelines to keep the competitors safe, yeah.
Both 6ABC and WNEP have a question about curbside retail. Curbside retail has opened up in New Jersey just over the bridge from the southeast region. But here it is not permitted in the red phase. Why? Small business owners see restaurants being able to do curbside pickups. Why can't retail?
Actually, retail is open now as of this coming Friday in 2/3 of the state, which are in the yellow phase, where curbside pickup is actually allowed. Again, we're trying to keep people safe. The more you congregate, the less you stay home, the greater the opportunity for that virus to spread. We want to keep people safe. I think we need to do everything we can to avoid contagion, avoid congregating.
We have another question from 6ABC. Lots of people were seen over the weekend at the beach in South Jersey, many without masks. Is there concern this region will see an uptick? Also, talk again, if you can, about how some activities can be low risk as long as you have a mask on.
Okay, let me see if I can remember those two questions. The first one is, if you go to the beach, I wouldn't go to the beach. There are people there who aren't wearing masks, and you're putting yourself at risk. I wouldn't do that. I haven't done that. And I'm not sure why the governors of Maryland and New Jersey have opened their beaches, but they have. What was the second question?
That was, if you can talk again about how some activities can be low risk as long as you have a mask on.
Well, again, the mask protects other people. When I wear a mask, I'm protecting you from getting anything that might come from myself. And when you wear a mask, you're protecting me and everybody else around you. So if you're not wearing a mask, then you're being fairly cavalier about protecting the people around you. And that includes people that you might care about very much. So I think in any setting where you're going to be close to people, you should wear a mask.
We have another question about gyms from Philadelphia Inquirer. A Bucks County gym reopened this weekend despite the Philadelphia region remaining in the red phase. What message do you have for the owners? And who is responsible for enforcing the business shutdown order? And how are they going to go about ensuring other businesses don't follow that gym's lead?
Yeah. Okay. First of all, I'm not sure about the formal enforcement, but nobody in any walk of life should want to put their customers in harm's way. And that's what opening a gym where you actually work close together, where you touch things that other people have touched, that's just not something that I would feel comfortable going to, a place I would feel comfortable going, because I'd be worried about risking my health.
Thank you. We have some questions for Colonel Montgomery. From the Times-Tribune, can you identify each nursing home at which the National Guard has sent medical staff or has provided assessment services?
As I had mentioned, we provided services, assessment services at up to 13 facilities and provided staffing assistance at 10. Some have been reported in the media. I can indicate the counties that we've been in, but did not want to indicate necessarily each individual site. We're in Beaver, Delaware, Lackawanna, Dauphin, Franklin, Schuylkill, Chester, Pike, and Northampton counties. Those are the counties where the facilities reside that we either are currently in or have worked in.
Thank you. We have a couple of other questions for you, Colonel, from WTAE. Is there an update on the National Guard's response at Brighton Rehab in Beaver County? Do they think they'll need to extend their time there?
We coordinate end dates with PEMA and the Department of Health. We are currently working there. I believe in the very near term, though, we will be done. And the facilities indicated we're no longer needed. But it probably in the very near term, within a day or two.
Also from WTAE, one more question for you, sir. Are you hearing from any National Guard member who responded to Brighton Rehab and Beaver County, and how have they been affected?
In terms, I guess I don't quite understand the question. Affected in terms of, I know they're very proud and happy to be there and be serving the Commonwealth and to assist very vulnerable residents. And so that's the only feedback I've received today.
Thank you. We have some questions for Director Padfield. From Fox 56, are you seeing improvements in nursing homes?
So that's a very difficult question to answer because it is such a dynamic response. So we see improvements in certain nursing homes, and there is a different level of intervention that occurs, and that is coordinated through the Department of Health. And that may start off as a telephone consult for an outbreak in that home, and to provide additional guidance and explain their guidance to the nursing home. In certain circumstances, we've seen improvements in those situations with just that intervention. And in certain other circumstances, the outbreak continues to grow, and then that's when we usually get the National Guard involved. We're also working on coordinating federal support to be able to bring in outside entities to be able to actually provide support to the homes as needed. So we've seen improvements in some of the significant outbreaks where they have lesser numbers or they have the outbreak contained, but we also see that we have new facilities some days that have outbreaks. So it's kind of hard to generalize on that, but it goes back to the fact that this has been a very dynamic situation, and ultimately it takes the Department of Health and the other agencies supporting this response looking at the data every day to be able to make informed decisions on how to act.
We have another question for you from CBS 3. Families with loved ones in nursing homes are outraged at the lack of preparedness experienced in so many facilities in the Delaware Valley. They were complaining to us about conditions 2 months ago. What should the state have done better? What do you say to those families about their characterizations these nursing homes were death traps?
So that's a very difficult question, obviously. The challenge is that no two nursing homes or long-term care facilities are created equally. So trying to generalize against a number of them is very difficult. And we see that, especially Colonel Montgomery and the National Guard that have been involved in this process. They're all prepared to different degrees. Very similar to emergency management agencies. Different counties have different levels of preparedness based on what their risks happen to be. So that's, ultimately, we want to be able to assist, and we understand that not everybody can be prepared at every level, and that's what our agency is here for, and that's what actually the county agencies are there for as well. And we've seen them do some tremendous work where they've stepped in to be able to provide some bridges for personal protective equipment until Department of Health is able to ship additional personal protective equipment out. So it really takes everybody working together to be able to bring the resources to bear on these issues, because they're quite diverse and they vary from facility to facility.
Thank you. Our next questions are for Governor Wolf. From WTAE, this past weekend marked the first weekend most of southwestern Pennsylvania was in the yellow phase. Are you getting any information on how things went in that region?
Yeah, actually Friday was the announcements last week were official on Friday, but today was the first day. For example, Pittsburgh was in the yellow phase. And I talked to the county executive, and he said that actually a lot of people, not very many people were showing up, coming into downtown Pittsburgh. And again, that gets back to when we get to enforcement issues. The ultimate enforcement is the confidence or lack of confidence that ordinary citizens in Pennsylvania feel, when they go to a place, a store, or back to work or to school. So we can do anything we want in terms of snapping our finger and saying we're going to go from red to yellow, from yellow to green. But ultimately, the decision makers are the people of Pennsylvania. And when they decide, as apparently they did this morning in Pittsburgh, that they're not going to show up, that's the reality that all of us have to deal with. They are actually trying to understand what that virus is going to do. They're trying to fight that virus, as we all should be. And that's what I think is a good object lesson, that some things are different now that the Southwest is in a yellow phase, but so many things haven't changed because people still are looking to feel confident.
Our next question is for you, sir, from Capitol Wire. During your announcement last Friday about additional counties moving to the yellow phase, you seemed to suggest that most Pennsylvanians don't understand the risks of COVID-19. And after 2 months of people self-distancing and for the most part putting their lives on hold, all to flatten the curve, we have succeeded in that. Excuse me, it's a long question. You appear to be telling people who are wondering why the flattening the curve goal wasn't enough, that they just aren't smart enough to understand the risks, of which they've been reminded every day, and can't be trusted to do the right thing. Was that the intention of your remarks on Friday? Absolutely not. In fact, the ultimate arbiters of success or failure here are the individual people of Pennsylvania, every single one of us. Now, I guess there are a lot of people like me who haven't been trained in public health, and we can learn a lot from the experts at Department of Health, PEMA, and other places, but ultimately we have to each make our own decision, and we are the experts. And each and every Pennsylvanian making that decision has done really phenomenal things for Pennsylvania. I think Drexel University just said today that doing what Philadelphians have done so far in this crisis have saved 7,000 lives just in Philadelphia. And that's true all across the state. By doing what people have done, by staying home, by actually living this pandemic in a way that reduces the possibility that this virus will spread, that has saved lives. So no, the idea was that there are things we can learn about how to deal with viruses like the coronavirus, but Pennsylvanians, I think, have learned that, and we have done a phenomenal job. From the York Dispatch, U.S. Representative Scott Perry has called for a federal investigation into your administration, alleging it failed to adequately protect nursing home residents during the coronavirus pandemic. How do you respond to this? Do you think it is another example of politics getting in the way of the state's recovery efforts? Well, I think that question probably ought to go directly to Representative Perry, but let me just point out that we have weekly calls with the congressional delegation where Secretary Levine and others give a briefing, an update as to what's happening with the pandemic here in Pennsylvania. And so
That is an opportunity to make sure that we're sharing information. In terms of challenging the Commonwealth on anything we've done, that's the nature of a democracy, and I welcome those questions and criticisms.
And our last question we have time for today is for you, sir, from the Philadelphia Inquirer. As of now, do you foresee having to extend the Philadelphia region's stay-at-home order past June 4th? Or should businesses and residents there prepare as if it is when they will enter the yellow phase?
We haven't made a decision. Philadelphia they have their own health department, and we communicate daily, and I think we're all trying to do the same thing, which is keep people safe.
Thank you very much, Governor. Thank you, Director Padfield, Colonel Montgomery. That is all the time we have for today. Department of Health will have a briefing today at 2:15. Thank you.
Okay, now what do we know from Governor Wolf? He won't go swimming. Not going to do it. Not going to swim in Jersey, Delaware, Maryland. Not going to swim in Erie. Not doing it. Not doing it. What else do we know? Him and Comrade Peduto are very, very close. He's not in public health. So he has no plan. Weak leadership. He can't even tell you what his plan is. Meanwhile, congratulations, Chris Sonata. Very good at taking the press releases. I don't even know if you're watching Nctv45 or just doing it on your own. April 30th, 65. 65 and 7 is 72. We've only had 72 cases. Congratulations there. As he tries to work. Now, at 1 o'clock, there was the unemployment compensation type thing, which they go, keep trying. That's their way of saying this. Now, hold on, because we don't want you to miss here in another 10 minutes. 10 minutes, you get the Secretary of Health. This is unreal. I have 3 breaking stories that I'm going to give to you. We're going to take a break. Go to sports. We'll be right back.
The Cedars Restaurant in Newcastle wants you to indulge in the food from their pleasing menu. The Cedars features Mediterranean, pub food, Middle Eastern cuisine, and so much more. They're open every day 11 a.m. to 10 p.m. Call the Cedars on the east side at 827 Addis Street, Newcastle. 724-658-9543. That's 724-658-9543.
Hello and welcome to the Cedar Sports Corner. Let's get to Major League Baseball. The question is, will an 82-game season and the players accepting that be enough for Major League Baseball to continue? Well, it's on, and they're talking about regionalizing it. So, you may see those Buccos play in Boston, the Yankees, the Mets, the Phillies, and Cleveland. Who knows? We'll keep you posted. NBA haven't said if they're continuing or canceling. And the NHL, no word on them. We're going to take a time out. We'll be right back after this. This program furnished by Sporting Goods, 23 East Washington Street, Newcastle. Call 724-658-2535. This program sponsored by Penn Ohio Bottled Water Company. Brian Ches, owner. Call 724-498-4760. Brian would be glad to visit. Peppers, mouth-watering fruit, fine dressings, apples, meats. This place looks so familiar. Everyone in Newcastle has to know about it. Yes, it reminds you of when you were growing up, right in downtown Newcastle. Look at those fine lunch meats and ethnic foods. Yes, it's Joseph's. Now, after we've been told by Governor Wolf, not going to go swimming, not going to get the suntan, not going to lie in the sun, doesn't know about Jersey, Delaware, or Maryland. This is very contagious. It's spooky. Used spooky last Thursday. Keep in mind that his illustrious Secretary of Health will be on at 2:15. So don't you go away from the Pennsylvania Comedy Show. I mean, this is better than anything. You can't write it. Him and Comrade Peduto feel strongly about everybody staying home. Unless you're going to watch NASCAR, and they're going to run around in a circle in front of an empty stadium and put it on TV. As long as they protect the people that are participating, he's okay with that. Governor Wolf funding for COVID testing and treatment for uninsured patients. Now, he's doing it for chips. Now, less than 1% of those kids had it. You can't even write this stuff. Okay, medical assistance, known as Medicaid. He's doing it for them. The guy just, he's so stuck in the east, in Philadelphia, that he can't see past the Susquehanna River. Except if Comrade Peduto is batting his eyes and flicking his hair. He distributed $255,000 in farm to food banks funding. Okay, so he's redirected that based on legislation introduced by Bob Casey and championed by Congressman Glenn Thompson. Great job there. Now, you know, we are moments away from sing happy birthday twice, and my mommy doesn't want to be in a nursing home, so she can make up her own mind. That's what's coming on. And now, when they talk, everybody that has a problem is in a nursing home. Because I guess there's no problems here. Now, I'm not saying be stupid. You know, first of all, the question he got the first round, who goes to a gym when they got the flu? I don't think anybody. Hardly believe you're going to go there if you have COVID or you're coughing or doing something like that. That's one. Second stupid question. On the masks. Sitting outside, you do not need a mask. However, if you're going to go to a small store and grocery shop, then you probably should wear a mask. I said small because of social distancing. If you're going to a larger store, they're probably going to require you to wear a mask. It's just a little common sense here, folks. This isn't rocket science. And I really am trying to understand the thinking here for what people don't understand about the mask. And now during allergy season, yeah, people could sneeze at a drop of a hat. I haven't been around any sneezers. You could sneeze because of an allergy. Okay, so wear a mask for that. I got it. But please, you're playing catch with your son. Maybe you have hay fever really bad out in the yard. You might want to wear a mask just so you don't get stuffed up. But come on. Governor, you got to be a little bit smarter than this. Please. Okay? Now, minutes away from the top, must have gave her top billing, because here she comes. He's looking, even this guy's looking at his watch like, when's he get? Oh, here she is.
Good afternoon. Thank you for joining us today. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 822 new cases of COVID-19. This brings our statewide total to 63,056 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. This includes 4,479 positive cases in healthcare workers. It also includes 13,626 positive cases among residents of 561 long-term care living facilities, which include nursing homes and personal care homes. 2,422 positive cases have been found in the food industry in 159 facilities. Tragically, 4,505 deaths in Pennsylvania have been attributed to COVID-19. We have done a lot of work to analyze the tremendous amount of data that we continue to receive regarding COVID-19 deaths. Under the best of circumstances, it often takes us several months, usually, to quantify and qualify this information. Our team of epidemiologists and data analysts have done extensive work to prepare more refined data for us, and I want to thank them for their extraordinary efforts. We have made a significant push to not only reconcile our data, but to report it in a timely way. For example, we are now reconciling data with the Philadelphia County Health Department on a daily basis. Previously, our data regarding deaths from COVID-19 came from our disease surveillance system, which we have talked about, and that's PA-NEDS. This process involved taking information reported about deaths from providers and matching that up with people who had tested positive. PA-NEDS is extremely effective in reporting disease outbreaks. But as we all know now, we have never seen a disease outbreak like COVID-19 in 102 years, with such a high and rapidly changing mortality rate. Today's data report regarding deaths will now look different among the counties. We have transitioned to using the Electronic Death Reporting System, or EDRS, to get as near to real-time information regarding people whose deaths have been attributed to COVID-19, in addition to those who have tested positive for COVID-19. We have done a significant amount of work to look at these official death records, and counties will now see some differences in their counts. For example, if a person who resided in a nursing home died from COVID-19, but actually maintained a residence in another county, their death will be reported in their county of residence listed on their death record. And that's according to the CDC guidelines about how we're supposed to report deaths. That might be very different than how the county coroners report deaths because of differences in their regulations. However, it is still very important to know how many people who reside in a specific long-term care facility like a nursing home or personal care home have been impacted by COVID-19. So, if someone who resided in that nursing home went on to die from COVID-19, we will be informing the public about their death in 2 different places on our website. Now, that's not being double counted, but we'll be reporting it in 2 different ways to relay both of those pieces of information. First, they are included based on their county of their legal residence, and that's listed on their death record, but that might not be their nursing home. They will also be included in the count of cases attributed to the facility, even if that's in a different county of their county of residence. So we're not double reporting, but it'll be listed in 2 different data sets. This means that these 2 charts on our website, our total death count and our long-term care facility death count, may not exactly match up because of the difference in terms of the county of their residence where the CDC mandates that we report our data. In addition, we've worked to add more information, more granularity, to demographics associated with people who have died from COVID-19. We will be reporting this information on a weekly basis and have broken down the data into categories which include race, ethnicity, gender, age, and their comorbidities, and we are doing this statewide. This information is available now on our website at health.pa.gov. As we go on, we will continue to add more data to our website and make it as transparent and clear as we possibly can. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. Please use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow,
Please sing
not
Happy
with your hands.
Birthday.
Don't touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your healthcare provider. And if you need mental health resources, because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741, or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. If you or someone you know is experiencing problems with an addiction, please call the helpline at 1-800-662-HELP. Again, 1-800-662-HELP. For the most reliable information regarding Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. From the Bucks County Courier-Times, when is the Secretary rolling out the plan to do mass testing at all long-term care facilities, residents, and staff on a weekly basis? And what are some specific details, such as will 100% of the staff and residents be tested weekly, and will there be retests? How will the department determine if long-term care providers are doing the testing?
So we're going to be rolling out that plan this week, and not necessarily every facility will be tested weekly. It's going to be individualized to the facility depending upon how many cases of COVID-19 they have. We have facilities that unfortunately have significant amount of COVID-19 cases. They'll be tested differently than a facility that has a few, which will be different than a facility that has no cases of COVID-19. So we're going to work to individualize the testing strategy to the facility.
The Bucks County Courier-Time also asks, when is the Secretary going to release the department's early plan to battle the COVID-19 virus in long-term care facilities that was not implemented?
So a lot of that was actually discussed by the governor and Director Padfield. I mean, so we had talked about previously having teams, sometimes they're called strike teams, but teams to go out to nursing facilities to help with infection control and staffing. So we have implemented that with the National Guard teams that were discussed. We actually now have some CDC teams that are going out, and so that will be announced. And then we're working on further strike teams. It was that strike team plan that was in our initial drafts, and there was some delay in rolling that out, but it has been rolled out.
From KDKA, according to your office, the collection of specific data from nursing homes in the state only started yesterday. There was some confusion that those numbers were to be reported last week. So did something change in that process?
I think there was some hope that we'd be able to report it last week, but it turns out that the data has started to be collected yesterday, and we're going to start the reports tomorrow.
A follow-up to that, your office also said the deadline for facilities to cooperate was today. What happens if they don't?
Well, if they don't, then we'll be contacting them to ask them to cooperate. This is the same data that they're actually being mandated to report to the federal government and the Center for Medicare and Medicaid Services. We did wait on our data reporting plan so that our data system in terms of this reporting was the same as CMS's, so that the reporting would be consistent.
Also from the Bucks County Courier-Times, why does the department need additional time to release the facility-level long-term care infection and death data? Your department says it started collecting May 17th. Hasn't it been collecting it all along? And if so, why the delay in releasing it?
Well, we have been collecting information, but in a completely different way. Again, we have different data reporting systems or internal systems, as we've been discussing today in terms of death reporting. We wanted to make sure ours was consistent with CMS. Otherwise, it would be apples and oranges. And so we waited for the CMS guidance. That came about 10 days ago, and then we worked on it last week, and now it's going to be starting to be reported tomorrow.
From Fox 56, are you seeing improvements in nursing homes since the new testing strategy was released?
I think we're seeing progress in long-term care living facilities with all of the different measures that we have in place. The infectious disease consults by our team and ECRI's team, the work of the Patient Safety Authority, the work of the National Guard, many different programs that we have to help these facilities. But I don't want to underestimate the challenges. You do have seniors, many, if not most, with chronic medical conditions in a congregate setting. And so our state, as has New York and New Jersey and Massachusetts and Illinois and other states, have had significant challenges with these facilities. And to repeat myself from before, we're going to do everything we possibly can to protect the residents and the staff of these long-term care living facilities.
From WTAE, this morning the state's website began reporting 38 deaths in Westmoreland County, while the coroner is reporting 32. Can you offer any information about what led to this discrepancy?
I don't know in terms of the specific county, but our team can investigate that and get back to you. But there will be some differences from our previous reporting because of what we just discussed and talked about.
From WTAE, also, what is the suicide rate since the shutdown, and what has the suicide rate been since the stay-at-home orders first began?
I don't have that specific information. Suicide rates are challenging to get. We get that information from our county coroners. And as we discussed, we have absolutely wonderful coroners working with the Coroners Association, but there are 67 of them. And so reporting from the coroners can be delayed somewhat as they do their investigations. So I don't have specific numbers, but we are concerned in terms of people who are depressed and anxious and feeling isolated and might be at risk for suicide. We're also extremely concerned in terms of substance abuse, particularly opioid abuse. And those are all things that we'll be working on in collaboration with our sister departments of the Department of Human Services and the Department of Drug and Alcohol Programs.
Also from WTAE, what has the overdose rate been since the stay-at-home orders began taking effect?
So again, I don't have that number, those numbers. It takes a while for overdose rates to come in, as I was previously describing. We have worked on that for a number of years now with our excellent coroners in terms of overdose reporting. But we are concerned, very concerned in terms of opioid abuse and opioid deaths due to overdoses.
From the Scranton Times-Tribune, during the last month or so, a trend has emerged between Lackawanna and Luzerne counties. Initially, the amount of new cases being reported in Luzerne County was substantial. Since then, new cases in Luzerne County have sharply declined, and the number of cases in Lackawanna County appear static. Is this also a trend observed by the Department of Health? And are there insights to explain why new cases have been dropping in Luzerne but have remained steady in Lackawanna?
I don't have specific granular detail, but our team can do a deep dive in terms of the data from those counties and then get back to the reporter.
Also from the Scranton Times, the death toll in Lackawanna dropped substantially today with smaller decreases in Luzerne and Pike counties. Any idea what happened, and did it have anything to do with the switch in reporting system?
Yes, it would be due to the switch in the reporting system. Again, it's most likely due to individuals who passed away in those counties, maybe at a hospital or at a long-term care living facility, but actually their county of residence was a different county. Unlike the coroners who would report it in their county of death, we have to report it in their county of residence, and so that's most likely the cause, but we can check on that.
From the caucus, the data you gathered for Speaker Turzai indicates an age breakdown showing almost 88% of deaths were people 65 or older. Are you surprised by the magnitude, and what does the data about comorbidity tell you?
I'm not particularly surprised. I think that clearly the data from Pennsylvania and the data from other other states and other countries show that seniors are most at risk of having severe complications to COVID-19 and tragically passing away. The seniors that would be most at risk are those with other types of medical comorbidities or other medical conditions. That could include heart disease, such as, for example, congestive heart failure, lung disease, such as chronic obstructive pulmonary disease. That would include chronic bronchitis and emphysema, kidney disease, diabetes, uncontrolled hypertension. So we know that those individuals are most at risk from COVID-19. But there are others at risk. They don't have a much less death rate, but they do have significant rates of illness, and that includes young adults and middle-aged adults. And of course, now we know that children are at risk of the new multi-system inflammatory condition.
From the Daily Press, if and when youth are allowed to resume participation in organized sports and other activities, is there evidence to suggest that the virus could spread among them asymptomatically and potentially infect their parents, grandparents, and other caregivers? Are youth being found less likely to contract, or are youth being found less likely to contract the virus altogether?
Well, we're still learning a lot of information about COVID-19. In general, youth and young people are less likely to have severe symptoms, and be either asymptomatic or have very mild symptoms. Of course, they could then carry that to their parents. So that's one of the concerns in terms of this type of community spread. Now, the multi-system inflammatory disease is actually post-infectious. It can be often several weeks after the COVID-19 infection and seems to be an inflammatory response to the virus that the body is mounting. So that's a separate issue.
From WLVR, can you give an update on antibody testing in the state? Is it widely available, and can Pennsylvania easily access it with low cost?
So we are working at getting that laboratory testing available at our laboratory. We probably should have that by the end of the month. There are some hospitals that are doing antibody testing, and I know that Quest and LabCorp are doing antibody testing. So someone could obtain that test by talking to their doctor and having the blood drawn. This is the blood test to look for antibodies. What we don't know yet is how long-lived those antibodies are, how long they last, and how much immunity they convey to the person, how protective they are. So we're going to be looking for that type of information as we get into the summer.
From the Post-Gazette, why is the Guard leaving Brighton tomorrow, and what goal did they achieve?
Well, they achieved a significant amount of progress at that facility and helped in terms of staffing and infection control and many aspects of the facility. Their mission is now being completed, and there's actually other staffing coming to Brighton. There's some overlap, and then the National Guard would leave for their next mission.
From the Tribune Review, can you explain what the new death data dashboard is showing and how it is different than what we were getting before? Specifically, what is the percentage column showing?
Well, I'm going to have to look at the percentage column, but this data is from a different system. This is from our electronic death reporting system, and so it's obtained in a different way. One of the things that we're going to have to deal with, as I was describing, is in terms of the differences between where a person passed away and what county they might be from and how that gets reported.
From Spotlight PA, the state is reporting 87 new deaths today, but a close look at the data reveals that death counts for a handful of counties have in fact dropped overnight. Why doesn't the health department's messaging today in emails and on the website reflect the full scope of what's happening?
Well, I believe we are reflecting the full scope, especially as we're reporting it in several different ways.
From Fox 43, any update on the recovery tracking, and when will the public be able to see any of that data?
We'll have that available this week.
And also from Fox 43, instead of bringing recovering coronavirus patients to nursing homes, is the state exploring other options to care for these elderly individuals and keep residents at long-term care facilities safe?
Well, we want to do everything we can to keep patients safe, and we'll explore every possibility of how to do that. Nothing has been easy, especially with the challenges faced in terms of these long-term care living facilities. But we're going to explore every opportunity we can to keep them safe.
From WKOK, We noticed some changes in death counts in our area. Montour County no longer has a death, and Snyder has 1 instead of 2. Northumberland now has 2. Any insight into these changes?
I think that these would be due to what we exactly talked about. Where a person passed away might not be their county of residence. And so with this transition today, there has been some changes, although from now on it'll be consistent because this is how we're going to be reporting deaths.
From WKOK, from a local VFW, will clubs, American Legion, VFW, fire companies, be allowed to open? Many say they could easily do the social distancing. They could wear masks, gloves, sanitize frequently, etc. It's not just the socialization. They support many community endeavors.
So it's certainly not in the red zone. We'll have to look at the yellow zone guidance in terms of those type of facilities in the yellow zone. And we're developing our green zone guidance this week.
From the Daily American, our county had 1 death and now has 0. We do not have any nursing home cases. A neighboring county had 1 and now is reporting 2. Is it possible that our county case is now being attributed to another county?
I'm not sure which counties you're discussing, but it's very possible, yes.
From the Tribune Democrat, a new weekly death report says The new weekly death report says the place of death of the decedent is reported by the medical certifier, such as physician, CRNP, or coroner, based on the physical location where the death occurred. Does that mean if a person who lives in one county is taken to a hospital in a different county, does that mean that they would be listed in the county where the hospital is located?
So that's how the coroners would list a patient. That they are required by their regulations to list individuals who pass away by the county where they passed away. So if they were in a hospital in County B, they'd be listed under County B. Our guidance and requirements from the CDC is to list them in their county of residence, and so that's why there are some differences.
From the Republican Herald, would the department consider subtracting long-term care facility cases from the county's total in determining the 50 cases per 100,000 benchmark? In the case of Schuylkill County, where the latter number is growing rapidly, it halves the county's benchmark number over the past 2 weeks to well below 50. We realize there are employers from that facility that come and go in the public, but a majority of the cases are residents who, of course, are confined, and some believe that suggests those cases could or should be counted separately.
We've discussed this before in terms of how public health officials and epidemiologists look at counties. We consider the whole county, and so that would include hospitals in that county. That would include long-term care living facilities in that county. It would include county or state prisons in that county, or food industry and manufacturers in that county. So we include all of those different types of facilities in a county's numbers.
From the Altoona Mirror, have death statistics been adjusted retroactively? In other words, the county of residence versus nursing home deaths.
I'm not sure the answer to that question. We're going to have to check it and we'll get back to you.
From the Butler Eagle, it's EMS week. Can you offer a comment on the efforts of EMS across the state through this pandemic?
Absolutely. Our emergency medicine technicians and staff have done such a absolutely fantastic job during this entire crisis. They were doing a fantastic job before, but we owe them a debt of gratitude for their heroism and their bravery dealing with this crisis of COVID-19, and I would like to thank them.
Thank you, Secretary. Those are all of the questions that have been submitted for today's press conference. Our next briefing will be tomorrow. Our next briefing will be tomorrow.
Okay, here we go.
Our next briefing will be tomorrow.
We have somebody that lives in Lawrence County. Their residence is in Lawrence County. They go without a hospital, i.e. Elwood, to Mercer County and get shipped to a nursing home. Maybe they had rehab, a broken arm, 1 year, 2 years. All of a sudden, when they pass away, Lawrence County gets credit. Oh, is that stupid? Thank you, CDC. And the health secretary doesn't even know why. Good thing you have NCTV45. 65. 7 deaths. We'll write that down. And put the date, because things are going to get screwy with the bookkeeping now. I mean, really? And she continues, sing happy birthday twice. 88% of these cases are in a nursing home. Holy cow. The numbers go even lower. She did say they're working on green this week. To let you know exactly what they plan to do. You can't write this, folks. These people are out there. They're doing their own thing. And there's a lot of people that are very, very skeptical. Folks, that's going to do it for Newswatch. I don't believe at 3 o'clock the next 2 hours are going to contain anything to have anything that's going to be breaking. So we're going to keep you posted. Thanks for tuning in. Make sure you tell a friend about NCTV45. And I think the theme song of the day is Sing Happy Birthday Twice. Maybe you want to sing it to yourself. I'm sorry. Pennsylvania's version of the comedy show. We don't doubt the seriousness. But now, changing in the middle of the stream, that's because they were having a problem. The numbers were going real low in some counties, and they were going to have to take them to green. She just doesn't know. She just doesn't know. Make sure you get that second cup of coffee and have a super day in what I call the greatest castle in the world in the county of Lawrence. Have a great day, everybody.